All right, folks, we're going to get started. We've got folks joining us online as well. Thank you for those who've joined already in the Zoom. It's good to see some folks from Massachusetts and elsewhere. It's always exciting to see who we're reaching across the United States. Welcome to FURst Aid, Reproductive Care for Dogs and Cats, presented by the Oregon State University Carlson College of Veterinary Medicine. So great to have all of you. My name is Jens Odegaard. I'm the Director of Marketing for the college. And at the Carlson College of Veterinary Medicine, our mission is to advance the health of animals, people, and the environment through inclusive and equitable education, research, and services to the public. We have 346 students currently. 312 are studying for their doctorates of veterinary medicine, and 34 graduate students in our comparative health sciences program. The college serves the public with research and direct clinical and diagnostic services through the Lois Bates Atchison Veterinary Teaching Hospital and the Oregon Veterinary Diagnostic Laboratory. A few housekeeping notes for today's presentation. For those of you online, at the bottom of your screen, please use the Q&A feature for your questions. Feel free to submit them throughout the talk and we'll get to them at the end. And then for folks in person, please hold your questions until the end and we'll have a Q&A session as well. A quick note that we will not be able to answer questions specific to your animal's case. Those should be handled with your personal veterinarian, but we can address general questions about reproductive care and emergencies for small animals. I'd now like to introduce today's presenters. Dr. Bill Whitler is a board-certified theriogenologist, which means a veterinary reproductive specialist, and an assistant professor at the college. Dr. Stricklin is a theriogenology resident and is also pursuing a graduate degree in comparative health sciences at the college. So I'll turn it over to you both.
Thank you. Thank you, Jens. We're gonna. You want the real camera on us or no? Just the room camera? Okay. Hello, Zoom land. I'm gonna start with a brief introduction, and then Dr. Stricklin's gonna do the male parts, and I'm gonna do the female parts. And when Jens asked us to do this, clearly we could spend an entire day, well, an entire hour talking about just, whelping in general. So that's a completely different topic. We'll kind of brush on it as a reproductive emergency, but I was trying to keep this more joined towards or more geared towards most of the animals out there, which are not necessarily breeding animals, but do include the animals that are sexually intact, as well as those that are neutered or spayed. So with that in mind, I do warn everybody that there are words presented in this talk that some people might find embarrassing, maybe comical, or hopefully not offensive. I did ask Jens if there would be small children in the room because sometimes it's hard to explain. But that being said, I can't talk about reproduction without using some of those words. So tonight, basically, we're going to do is cover potential scrotum or testicular issues in the male, penile issues in the male, and then potential prostate issues in the male. And then we'll talk about female perineal issues, uterine issues, and mammary gland issues. Okay, so I'm going to turn it over to Dr. Stricklin, and she's going. Oh, I forgot my one other slide I added. So again, most of these are applicable more to our intact animals, okay, than the conventionally spayed or neutered. However, depending on where you are, you might be familiar with the concept of an ovary sparing spay or just a hysterectomy as opposed to the conventional ovariohysterectomy. So those animals basically are left with their ovaries intact. And in the males, we do vasectomies just like men. So they are no longer fertile, but they do still have their testicles. So again, they continue to produce the sex hormones. There's evidence to suggest that it's beneficial for the health of the dog if we remain them sexually intact, but basically sterile. And so the same problems that we encounter in an intact female or an intact male dog, we can see in those. So the bottom line is, you may say, well, my dog has been fixed, but if he's still got his gonads or she's got her gonads, these same problems. And then some of the trauma we'll talk about, especially in the males, we do know those intact males are more likely to fight amongst themselves, leading to sometimes the injuries we see. Dr. Stricklin.
Thank you, Dr. Whitler. All right. So to start, we'll go over the male, and then Dr. Whitler will jump in the later half for the female parts. So first we're going to touch on just kind of basic trauma. You take your dog to the dog park and perhaps with the gonads intact, he gets in a fight with another dog. As you can see in this picture, he's got a scrotal laceration, a big cut on his scrotum. He may get in a fight with other dogs, other animals out in the backyard. I know my dog likes to chase the raccoons at night. Getting into plants with thorns, fences, whatever in the backyard, if they get loose, even self-trauma, if they're self-mutilating, that's always a possibility. However, if they are self-mutilating, something else may be underlying that. So you need to get to your veterinarian so they can figure out the underlying cause for that. These are rarely life-threatening unless they're bleeding excessively. Hemorrhage is always an emergical or veterinary emergency. But whether they get treated either immediately or the next day kind of depends on how important their future fertility is to you. If they're going to get neutered anyways, saving the gonad may or may not be your top priority. Moving on, we're going to go to the penis and the preputial area. So the penis sits inside the prepuce, the skin, the sheath over the penis. Dogs are unique in that there's actually a little bone in the penis called the os penis, and this can potentially fracture. That can lead to problems. Either he has problems urinating, it gets really swollen to where he can't, he's just very painful all the time. And in addition, within the penis, there are several different cavities that kind of fill with blood whenever he gets an erection, if he is intact. And if these are lacerated, he can also hemorrhage and have bleeding, and that can cause a lot of problems down the line. It may or may not be bad enough that he potentially needs surgery. If he has a laceration to the urethra that sits within the penis, it may eventually cause problems with his future fertility if you're going to be using him as a breeding animal. And then something that a lot of people call about is that their male dog has a mass at the base of his testicle. So if you look up in this bottom picture, I don't know if you can see my mouse or not, the bottom right picture, there is a lump in the preputial area just in front of his scrotum. That is not a mass. He's just very excited, and that's part of an erection. So that is not an emergency, just to let you know. That's called the bulbus glandis, and the picture to the left of it, the bulbus glandis engorges, and it helps keep the breeding tie. Normal reproductive issue, but it's actually not an emergency. Moving on, swelling is always a problem. It can point to any number of things. It could be fluid within the scrotum, around the testicles. You can see on this ultrasound on the bottom right-hand corner. These are the black areas, just fluid around those testicles. Getting him to a doctor immediately and trying to figure out what exactly that fluid is, where it's coming from. Is it blood? Is it any sort of other fluid? Other things that could be causing the scrotum to enlarge would potentially be a hernia. So things from the abdomen are actually going into the scrotum. Depending on what is herniating into the scrotum, it could potentially be life-threatening. If the intestines get trapped in the scrotum, they could die and cause a lot of issues. And then your dog may get really sick, may have to undergo surgery to correct that. If it's omentum's kind of like this piece of fat in the abdomen that kind of keeps things, we call it the policeman of the abdomen. It kind of keeps infections at bay, and it just kind of protects the abdomen as a whole. This, if it gets into the scrotum, is not life-threatening, but it does need to be corrected, especially if he is going to be breeding in the future. Orchitis just means inflammation of the testicle. Epididymitis is inflammation of the tube that exits from the testicle. And some underlying causes for that could potentially be what's called a brucellosis infection. It is a bacterial infection by Brucella canis, and this is a sexually transmitted infection. It's also been shown to be transmitted just by casual contact. Somebody sniffs somebody's genital region, and then they lick their own genitals, and causes an infection. We don't see it very much up here in the Pacific Northwest, but it's a lot more common down south. The problem with this is A, it's zoonotic, meaning that you as a human can catch it and it can give a nasty infection to you. And it's not curable in dogs. It is in humans, but not in dogs. So we recommend if it's a really bad infection that he be neutered, and depending on the extent of the infection, potentially euthanized. All right, swelling without obvious trauma. The penis can undergo priapism. Basically, this is just an erection. It is stuck out. The penis is stuck out and it won't go back in. Paraphimosis is also where it's just kind of stuck out. It may be secondary to a very small opening in the prepuce, and if he gets excited and he gets it stuck out and he can't get it back in, then it continues to swell and then it just stays out. The longer it is out, the more damage occurs to the penis, so this is an emergency. Sometimes they can get stuck out in the longer haired breeds, especially if hair gets stuck around it and it can't go back in, and it restricts the diameter, it cuts off blood flow, it gets really swollen. Similar to the Viagra commercials, having it out too long is an emergency. Also, it's worth noting preputial prolapse. So over here, this is a picture of the end of the penis, and this little kind of flower looking thing at the end of the penis is the urethral mucosa. If it is prolapsed, they might be able to urinate just fine, but if it is protruding from the penis, then the dog might be irritated, might lick it, may cause more trauma, and it just ends up snowballing and it gets worse and worse. Some are self-limiting, others need surgical correction. However, your vet can rule out other issues, maybe a UTI, or it has been shown that extra abdominal pressure from like coughing or having breathing issues may cause this as well. We see these a lot in the smushy face breeds, the brachycephalic, such as bulldogs and Bostons. And then it's worth noting, dogs do have prostates. That's their only accessory sex gland. Similar to humans, these need to be checked at every vet visit, the yearly visits. Predominantly, this is an intact male problem to have prostate disease, but we do sometimes see it in neutered males. So even the neutered males do need to be checked out by your regular veterinarian. The biggest problem we see is it gets too big and the dog gets uncomfortable. He's straining to pee and defecate. And a lot of the times you'll see that he's straining and you'll have a ribbon-like stool in the backyard. Sometimes it can get so bad it can cause blood in the urine. And so anytime you see them straining to urinate or defecate, that's always an indication they need to go get checked out at the vet. And Dr. Whitler, I'll hand it over to you for the female parts.
Thank you, Dr. Stricklin. So we see various problems associated with the perineum, which is basically the area, south of the rectum or south of the anus. So, and some problems we see in the pregnant animal, some problems we see in the non-pregnant animal. And then obviously we see uterine problems in both pregnant and non-pregnant, and sometimes even spayed dogs. And cats, and then we see mammary problems. So that's what we're going to talk about today. So if we talk about the perineum, the vagina, the vestibule, in the non-pregnant dog or cat, obviously we can see trauma, which just from any, again, dog fights or other types of trauma, you can kind of pick any of the same things that occur in the male. Prolapsed vaginas, basically we see, usually mostly these are in intact animals that have ovaries, and we usually see it when they're in estrus or in heat, because the hormones of estrus cause everything to relax and to get swollen. And usually in those dogs, it's self-limiting after they go out of heat, okay? But occasionally they can get pretty extensive. Again, the dogs are uncomfortable, they can lick at it, and they can create a certain amount of self-trauma. So usually we use some kind of emollients, either some, like a oil-based ointment. Some people like preparation H because it has chemicals in it to reduce the swelling, or some kind of cortisone. I do caution people though to avoid using things like Desitin or zinc oxide, because especially if the dog can continue to lick it, if you use something like Desitin, which has a lot of zinc in it. The dogs ingest it, and then they can have a zinc toxicity. So again, something like Vaseline or preparation H, and then obviously potentially the cone of shame put on so that the dog cannot lick itself. And in severe cases, vaginal prolapses actually require some kind of surgery. Again, if it's repetitive, we kind of pick on the pushed in face dogs. We do see it a lot more in the bulldogs. If the people aren't going to have the dog, if they're not going to breed the dog, they may want to consider spaying it. Okay. And then we sometimes see these issues in spayed dogs, and oftentimes the root of the problem. So if you see this and you say, well, gosh, I listened to that guy on the internet and he said, my dog won't do that, but my dog is spayed. If anybody in the household, this has become much more common in the last few decade or so. Think about exposure to other hormones that someone in the household might be taking. So there have been numerous reports in the literature in the last few years about dogs who have ingested hormone replacement creams from the humans that they live with. And people don't think about it. They apply the creams and then they get it on their hands. And then the dog comes along. And what does the dog like to do when you have something on your hands, but is lick it off? And so people don't always put two and two together. So sometimes in our case, it requires us to be a little bit careful about the questions we ask. But I ask, is anybody in the household, applying those types of products, or potentially oral hormone replacement therapy? If the dog managed to get into the medicine cabinet or somebody dropped pills on the floor. We do occasionally also see vaginal tumors, which can push out through the side of the vulva. Again, those would just show up as a little lump, poking out, or in some cases, if it's not big enough to be protruding yet, the first sign you'll see of this would be that the dog will be licking themselves excessively, or possibly urinating, inappropriately more frequently than normal, because the dog basically senses that something's not right down there and you can't figure out what it is. And again, this would require some type of investigation by your veterinarian. Again, in the non-pregnant dog, we see vaginal masses. We can see vaginitis as inflammation of the vagina. We've seen this again, both intact as well as spayed dogs from foreign bodies, grass-ons, things like that manage to find their way in there. The dogs are out, and if they're out in the environment. And again, I already mentioned exposure to hormones. So again, that can happen in either case. So in the pregnant dog, if we see discharge, normally, or if it's a little bit mucoid or bloody, we get a little concerned. But again, depending on how close the dog is to parturition or delivery. Again, we see vaginitis also in a pregnant dog. Uterine infection or pyometra, we're going to talk about it a little bit here in a second. Obviously, if it's a pregnant dog and she's not due yet, we worry about abortion. And again, that really is a complete talk of its own. We're going to touch on obstetrics a little bit here, but I could spend the entire hour just talking about that. But the bottom line is pregnant dogs, along the sides of the placenta where they attach, they have this green uteroveridin, it's called, and it has to do with, it's a type of hemoglobin that transmits the oxygen in the blood to the puppies. And so if we see this green discharge, it usually means that the placenta is starting to separate, and that usually means that puppies are on their way out. And if the puppies are not delivered, it is a true emergency. So we tell the students green means go. Usually if you see green and the dog is pregnant, you better be thinking about going to the veterinarian, because something's not right there. Okay. Pyometra is probably the thing we see potentially the most life-threatening. We usually see these again almost exclusively in dogs that are intact. They usually occur in the 2 to 8 week span after they were in heat, and that has to do with the hormones that are residual from the previous cycle and the ovulations that have occurred. Okay, oftentimes a dog with a pyometra or uterine infection is drinking a lot of water and then subsequently urinating a lot. So if you've got a dog, she went through heat a few weeks ago, she sleeps in the bed with you like mine do, or she's just normally a good dog and she's waking you up in the middle of the night to go out, or she's peeing in the living room because she can't hold it anymore. The little bell should go off that, it's possible that your dog has a uterine infection. It's easy to confuse with a uterine infection or a bladder infection, bladder infection or cystitis. Okay, again, those dogs are also urinating inappropriately, and they can't hold it. And so sometimes people get down the wrong path and they'll do a urinalysis. In other words, they take some urine into the veterinarian who looks at it and says, well, it has pus in it, so the dog must have a urinary bladder infection. And again, the pyometra urine infection goes undiagnosed. And again, it's important, especially if this is potentially a breeding animal, because the longer that infection stays there, the worse our prognosis for fertility is later on. And also bear in mind, if you're with your veterinarian and they think, oh, maybe it's a bladder infection, and they're going to do a urine sample by a needle, remind them that your dog has a uterus and say, well, could it be a pyometra, doc? Because again, we all make we all go down the wrong path. I mean, I'm made as many mistakes as probably anybody. And so I always warn the students, make sure you think about the fact that there might be a uterus in there before you poke a needle in there to try to get, urine out. If you're not going to breed these dogs, spaying them is probably your best option financially, as well as the health of the dog. We do see a condition called cystic endometrial hyperplasia, which again, we mostly see in the older dogs, and it predisposes to this. But these can be treated medically if the dog has a valuable breeding potential. But by the time you treat with all of the drugs it takes to fix these, and these require several weeks of medical management to clear them up, they can be more expensive than the cost of the surgery to spay them. So again, usually surgery is the treatment of choice if there's no reason for future breeding. But the bottom line is dogs that get these like to do this again. So if you're gonna breed the dog, you have to breed her on her next cycle, or she'll just get another pyometra. Okay. The pregnant uterus, again, obviously we can see early embryonic death or abortions, and some kind of problem with normal labor, or abnormal labor. And the stages of labor, if you're not familiar with them, stage 1 is just getting ready for the delivery. Usually we see a temperature drop, typically in 12, but more likely 24 to 48 hours before whelping actually begins. The dogs are usually panting. They usually don't want to eat. They're usually nesting. Sometimes they're carrying babies around, toys and things. And then hopefully they're also making milk. Stage 2 is basically the delivery. The classic literature always says, well, there should be no more than 2 hours between puppies. However, we've all experienced those dogs that have gone. We had one dog that went 48 hours between her labor and us eventually doing a C-section, and all the puppies were still alive. So fortunately, the puppies don't always read the books, but conventional wisdom has been, if you know there's puppies left in her and it's been more than 2 hours, you better at least be on the phone to your veterinarian, if not in the office. And then stage 3 is delivery of the placentas. Okay, if you're going to have a breeding animal, the dogs like to eat these. Okay, I'm okay with them eating 2 or 3. But some of these dogs, if you have a large litter of 10, 12 puppies, those dogs, those females, those bitches eat all of them, and it can give them quite a bellyache. And so I usually try to limit the number of them once they've eaten the first few. And that can happen after they've delivered. I had to have at least one cat picture. We don't see that many cats here. Fortunately, cats have fewer reproductive problems. We can see uterine infection in both everything, just like, again, uterine infection because of retained placentas or even without. And this is actually a cat whose uterus is prolapsed. I've actually never seen this in a dog, but I know they can hurt her as well. Obviously, these are pretty significant emergencies, especially if we want future fertility, although I don't know that anybody ever even tries. When I've actually seen only 2 of these in 38 years, and we just removed the uterus. But the one cat, the first one I saw, was actually had queened underneath the front steps, and the people didn't even know there was a problem until it started to smell bad. So it wasn't making the cat sick, which was amazing. But we removed it. And then there's a condition called subinvolution of placental sites, or SIPS, and that has to do with the locations where the puppy's placentas were attached. Okay, and then for some reason they don't completely heal themselves like they're supposed to, and they continue to bleed. These are kind of a little bit more of a nuisance. These dogs bleed more vaginally postpartum than normal. We usually expect their bleeding to be stopped by probably 2 to 3 weeks. These can bleed for weeks, if not months at a time. There's a lot of debate in the literature about what to do about them. Some people use Chinese herbs, some people use some other drugs, some people put them on progesterone drugs. The bottom line is most of the time, as long as the dog is not getting terribly anemic, it's a nuisance, but you just let it run its course. And then usually at a subsequent heat or a subsequent pregnancy, it goes away. So last thing we're going to talk about then are the mammary glands. Obviously, they are part of the reproductive tract. They're important, for our mammals. Pseudo pregnancy or false pregnancy in dogs is more or less normal. They maintain their hormones, whether they're pregnant or not, for approximately the same amount of time or 2 months. Some dogs then towards the end of their cycle, when they would normally be going into labor if they were pregnant, but they're not, do go through some, nesting behaviors and the same behaviors we see, and they can even develop normal milk. And again, if they develop milk, whether they're lactating or whether they're not pregnant, that milk can potentially get infected. It's why we don't keep the milk out on the counter all day long, because it likes to grow bacteria. So we get infections in it. And in this lower two pictures was a dog that had a mastitis. And so she initially came in and was quite swollen. The mammary glands were hot. The bad news is these are really frustrating. We put these dogs on antibiotics. Most of the time, though, they actually blow out. And then eventually these heal really well, amazingly enough. It's just a question of keeping them clean. If you're trying to deal with these at home and you have a dog with mastitis or has and then eventually does this, the trick we've learned or we recommend is buy a small t-shirt, depending on the size of the dog, whether that's a toddler t-shirt or a children's small t-shirt, and then tie it up so you can protect it so the dog isn't dragging those mammary glands. Obviously, if the puppies are still trying to nurse, this can be problematic. So in some cases, this requires weaning the puppies early and then possibly having to bottle feed them. There is a condition in cats, or mostly cats, called this mammary hyperplasia. Again, we usually see this associated with their normal cycle, or in some cases, people will give progesterone-like drugs to cats for a variety of reasons. Some of it's to keep them out of heat. Some of them is actually for skin conditions. And so they develop these these humongous mammary glands. And again, there are some drugs that can be used to treat it. But in reality, oftentimes the treatment of choice is to spay them. But I think you can appreciate with a mammary gland like this, doing surgery on this cat to spay it can be quite a challenge. So sometimes you have to wait for it to heal before you can actually do the surgery. So with that, I will entertain any questions. Do I need to open the chat or you're going to do it? Okay. I see 22 chats. Any questions in the room? Okay.
There's one online, and if you could repeat it.
You want me to read it?
How likely is it for preputial prolapse to happen on a neutered dog?
There's some papers out there that say it is testosterone driven. I don't know in my thus short career thus far that I've seen it in any neutered males, but I will never say never. That's bitten me in the butt a couple of times, but the chances of that are relatively low.
Yeah, I think it's probably much less likely in a neutered dog. But again, if you had an English bulldog, I'd probably say it could happen.
Another question in the Q&A, what's the origin of brucellosis?
What's the origin of brucellosis?
And what happens when a female catches
Okay.
it?
Boy, I wish I knew where brucellosis. We actually deal with, I don't know, 5 or 6 species of brucellosis. So anybody out there who's had cattle might be familiar with Brucella abortus, or if you watch Yellowstone about Brucella abortus, that's been in the bison and the elk in the Yellowstone basin. And that disease has been trying to be eradicated, or pretty much eradicated, in domestic cattle in the United States now for the last few years. There's a Brucella melitensis that we see predominantly in small ruminants, and that's in the Middle East. There's a Brucella suis that's in pigs. In the United States, it's mostly restricted to feral pigs. I'm not sure about its distribution in the rest of the world. Brucella ovis we see is almost ubiquitous in the sheep population in the state of Oregon. And then we have Brucella canis in the dog. So I'm not exactly sure where they all originated. They've been around for probably millennia. The bottom line, usually what we see in dogs is if the dog is infected, they'll typically have reproductive problems. A lot of times because it's predominantly a venereal disease transmitted at breeding, the classic disease is the dog gets pregnant and then aborts. But the bacteria actually hides within the cells of the body. And so the dogs go through periods of active infection and then basically remission. And so they're not always actively shedding the bacteria. And so it likes to hide. So the dog might abort and you think everything is better. And then the next time you breed the dog, we have another abortion because the bacteria gets active. Or in some cases, the female can then transmit it to the male. But the male can transmit it to the female in obviously just the act of coitus itself, but also in the semen. So even chilled semen and even frozen semen can transmit that bacteria. So we strongly recommend that if your dog is being used for breeding, that it be tested for brucellosis at least annually, at least in this part of the country. As Dr. Stricklin mentioned, if you're in the Southeast, down there, they recommend testing for it twice a year. Or if you have a male who's pretty sexually active and breeds a lot of females, probably consider testing him twice a year, just so you don't run the risk of him having been exposed to it, because once you get it into your colony, it's basically impossible to get rid of.
Real quick, Dr. Whitler, so we've got one question in the chat, but if you open up the Q&A at the top, there's a
that
bunch
one.
more in there.
Oh, I see. Okay. You want me to just read them then? Are they in order? Just do them in this order. So, can everybody then see them on the chat now? Can everybody see them, or do I have to read them?
Go ahead and read it.
Okay. So do you have a recommendation for the oldest to breed a bitch for the first time? I don't necessarily. It depends a little bit on the dog, because we know the small dogs live quite a bit longer than the giant breeds. Conventional wisdom for a giant breed is probably 5 or 6, maybe 7 years old. We have some toy poodles that are breeding well into their double digits. So I guess I don't have a specific time recommendation. Oh, this for the first time. Well, the sooner the better. And here's my analogy for some of you. I think the uterus likes being pregnant. Okay, this sounds really bad, but many of you probably have had the same experience as me, where we've all known those couples who've tried to get pregnant. They spend a lot of time getting pregnant, and then usually the second baby comes along quite readily because the uterus likes being pregnant. So I'd rather deal with an older dog who's had multiple litters than the older dog who's just never been bred before. So, and maybe I'm also misreading it. Maybe you mean the age to breed the first time. For that, I usually recommend after the second heat cycle. Okay. Partly because the first cycle, we know sometimes those cycles can be a little erratic. And we also know litter size is smaller in the first cycle. And conventional wisdom, at least when I was in school, we used to they recommended you skip a heat and then you breed every other heat. But we've pretty much thrown that out the window now. Now we just recommend you breed them every time they're in heat, unless there was some reason for that dog to lose its body condition during the pregnancy or in that time in between. Because the dog goes roughly 6 months between cycles, there's really no reason. And again, just like I mentioned, the uterus likes to be pregnant, so it's better off just breeding every time, unless it doesn't match your other reasons to breed them. Are any of these problems hereditary? Certainly some inguinal hernias can be hereditary. Certainly the prolapsed urethral prolapse, because we know it occurs in certain breeds, and there's going to be a certain heritability to it. Can you think of anything else we mentioned that would be heritable? Vaginal prolapse, again, somewhat heritable, but again, we mostly see it in the brachycepto, especially the pushed in face dogs with a lot of skin.
I think that about covers it.
Yeah, that's about all I can think of. Is drinking a lot of water normal during pregnancy? Obviously, to some degree, yes. But again, it just depends on how severe it is. Usually I don't expect the normal pregnant dog, though, to be drinking an excessive amount of water to the point where she's urinating inappropriately in the house, except possibly when she's really late pregnant. If you think about it, if there's a lot of puppies in there, there's not a lot of room for that bladder, okay? So if she's only a week or two away and she's gotten big as a house, maybe she just can't hold her urine like she used to because there's just not enough room in there anymore, okay? Is the lack of the cure for brucellosis a question of economics or a question of poorly suited antibiotic? Well, part of the problem has to do with it's an intracellular bacteria. So we're not very good at getting antibiotics into the cells that have the bacteria that are inactive at that time. Again, there have been some protocols where the dogs have been given antibiotics for months at a time and gotten them to basically go into remission, but I'm not sure anybody's ever considered them completely cured. And you talk about calcium supplementation during labor. Again, lots of different products out there. The commercial products, the gels are available. Some people will give Tums. Some people just give, have them eat yogurt or cheese or ice cream. And if you actually, at least I've tried to look for specific amounts of how many milligrams to give per pound or kilo of dog, and really don't have a good answer for what that is. We kind of joke about the stupidest kidney is smarter than the smartest veterinarian. So the good news is, when we give excessive amounts of calcium orally, the body seems to naturally get rid of what it doesn't need. But obviously I wouldn't give the dog an entire bottle of calcium, but conventional wisdom is, people will give some kind of calcium option in between each puppy, trying to keep their calcium up. I wish I had a real number for you, but I don't. I live in Jackson County trying to find a vet to spay my English setter, leaving the ovaries. Have not found a willing to do this. Yes, you can call our hospital reception and get it scheduled. We're booking probably almost 6 months out now, but we are doing these here. Do you associate C-section OVH with higher rates of post-op complications, bleeding? And if so, is this such elevated risk that it's advised against? Interesting question. I can quote you 2 different studies. One suggests that survival rates of dogs that have been spayed at the time of their C-section have a higher risk of fatality. I can quote you another study that says they compared the risk of C-sections with or without ovarian hysterectomies and found no difference in survival rate. My answer to that is the one study that said there was no difference was done at a university teaching hospital, where I'd like to believe, with all due respect to private practitioners, I was in private practice for 20 years or so. I did not have board certified anesthesiologists dedicated to running anesthesia when I was doing surgeries. And I think so as a general practice, in general practice, I would probably say I wouldn't do that. We actually try not to do them here because, again, I think there is more risk. What we've actually started doing is, instead of doing a complete ovariohysterectomy, when people say, I don't want to breed my dog, is that we just take the ovaries, we leave the uterus. So we're leaving all of that big bloody stuff in there. We're not removing that at the time of surgery. And so far, that has been good for us and several other people. Dietary changes, enhancements during pregnancy. I think if the dogs are on a good balanced diet, I don't usually change a lot. Certainly some of the dogs that are predisposed to cleft palates, like the bulldogs and such, will supplement them with folic acid. If you want to start a dog, regardless of what she is on folic acid, it's a pretty safe vitamin. Whatever they don't need, they urinate out. There are doses out there, but the doses are pretty wide. I don't have one off the top of my head. I will make my plug, and I'll probably get a few people irate with me, but I do mention this when I talk to clients that we're breeding dogs for. If you're a big proponent of raw diets, and I'm not going to get into the argument of are raw diets good or bad. I know certain people, I know there's a certain body of evidence that raw diets might be better for dogs with allergies and such. But you have to appreciate the pregnant dog is immune compromised. In other words, her immune system's suppressed because the puppies are actually not genetically all hers. And so because her immune system is suppressed, she's at a greater risk of infection. And I'm not saying processed foods don't have bacteria in them in some form, but we know statistically raw diets have more bacteria in them than processed foods. So if you put all the money into trying to get a dog pregnant, why would I want to risk that by giving her a food that might have more bacteria? Just my personal opinion, you don't have to believe it. Can incontinence be caused by stress? Not that I've ever heard, so I don't have an answer for that question.
Might be worth getting checked out at the vet for.
Any recommendations for a breeding bitch who doesn't have obvious heat cycles? She's 4.5 flat coat and has had heat cycles. I haven't bred her yet, but I'm trying to decide whether to. If you had a male, you could use him as a teaser, but that's probably more than you want to do. But the only other option would be, at least for us, we do vaginal cytologies where we take a cotton swab and we insert it in the vagina of the dog and we get a sample of those cells, and we can identify when the dog is in heat with those. And usually the changes that we see occur at least a week or so prior to her fertile period. So if you could if your local veterinarian is willing to do a vaginal cytology for you once a week, or in some cases, we have clients who do their own vaginal cytologies, and then they just bring us the slide. That would be the fastest way to evaluate her, short of doing repetitive blood testing. Is there little to no risk of PIO in dogs that have just had ovaries removed, but uterus left? Yes, correct. If you look at Europe, a lot of Europe has been doing simple ovariectomies without an ovariohysterectomy for decades. The uterus without the ovaries basically becomes just an inert tubular organ in there. The reason we see pyometras is because of those hormonal changes that occur again after the dog ovulates, and that's why we see them basically in that 3 to 8 week, 6-8 week range after they've been out of heat. So without the ovaries, the risk of pyometra is virtually zero. If you leave the ovaries intact, though, that's why when we do an ovary sparing spay or a hysterectomy, we actually have to remove at least part, if not all, of the cervix, because even the cervix can result in a pyometra, which is one of the things I didn't mention. Stump pyometras associated with a dog that's been spayed. But again, if you have a remnant of the uterus and it's infected, we usually think about one of two things. Either there's a remnant of an ovary that's still in there, okay, and somebody missed it when they did their spay, or in some cases, it has to do with a reaction to the suture material that was used because at the time of the spay, or is it possibly related to a tumor of the uterus or the cervix, basically where the spay was done. Is it common for pregnant dogs to get ear infections, and should they be treated while the dog is pregnant? I don't know that we ever see any more ear infections in pregnant dogs than other dogs. I always worry about treating them in a pregnant dog because some of the antibiotics that are used in most of the common ear medications can potentially be detrimental to the pregnancy, especially early. And then some of the ear products have corticosteroids or cortisones in them, which can also potentially abort the dog. So I treat those pretty carefully. I try to use medications that don't include, just kind of normal cleaning as opposed to that. But in severe cases, we have to use it, in which case then it just requires, careful use of drugs that we think will have the least likely adverse effects on a pregnancy. When would you do ovariectomy versus ovariohysterectomy? Again, at least here, And a lot of practices now, if they're doing their surgeries laparoscopically, many of those are doing just ovariectomies, because in order to remove the uterus, so, if you know anything about laparoscopic surgery, it's just a couple of small portals and a couple of small instruments, and you go in there with a camera and you look at the ovaries and you remove them, and they basically come out the holes that the instruments went in. So they're pretty small hole. In order to remove the uterus, you have to make a larger incision. Okay, so they call that laparoscopic assisted. So usually if it's, as long as the uterus is normal, ovariectomy, again, just as far as I'm concerned, they're more or less interchangeable when it comes to the health of the dog. It just depends on whether you're doing them laparoscopically or you're doing a conventional open surgery. Uh-oh. You want to do the chat?
Age for cat breeding.
About what?
It might be buried in there. So
X and Y, what? What was
cats?
Between X and Y? Is that, I assume that's ages?
I think so, yeah.
I don't know. Do you have a cat recommendation?
I don't, preferably when they're full grown, same as a dog, but
Yeah, I mean, I think a lot of it has to do with, again, I'd probably not, I mean, obviously they kind of cycle, their cycles are a little bit different. But, in terms of their induced ovulators, but, certainly waiting, not the first time they're receptive. And in theory, if they're not receptive, if they're receptive today and you don't breed them, they're going to be receptive again in a week or so. And then they're going to be receptive again another week after that. So the bottom line is, it's not like a dog where you're waiting 6 months. Okay. It's a question of, just a few weeks. And bear in mind, because cats are seasonal breeders, those kittens born earlier in the year might actually cycle sooner the following year than kittens born later in the year. I think maybe I misread it. Was there a question about increasing milk production, or was that the question about semen production?
Semen production.
Okay, maybe I misread it. Any suggestions to increase semen production in older male dogs? I wish I had one, and I don't. Again, good planes of nutrition. There are a number of supplements out there, and as far as I know, with very little science. So or no science. So I'm always hesitant to recommend a specific supplement, but people have tried different things. I am admittedly sometimes a skeptic when it comes to acupuncture, but I've had people actually say they've seen improvement with acupuncture. And because I can't give you an answer of what to do, I always talk to clients when we have a male dog that's having infertility or subfertility issues. If the client is reasonable and is willing to try acupuncture, I usually refer them to an acupuncturist. Again, a lot of things we don't have hard science for. There's anecdotal reports. We did it and the dog semen production went up.
I'll take it back, Dr. Whitler. There is a question, any suggestions to increase milk production in lactating bitch?
Dr. Stricklin has one.
I love this question. There are a few drugs that we can give as veterinarians. One is a dopamine antagonist, called domperidone. It's used in horses if you're a horse person. We've also adjusted the dose for dogs. I believe metoclopramide has been used by veterinarians. There's some evidence that acepromazine increases milk production as well. Something you can buy over the counter. It's called fenugreek, FENU Greek. I believe you can buy that just at like Walmart or wherever you buy your normal drugs. There's not an actual dosage out there. A lot of breeders have told me that they give it until the dog's breath or the whelping area smells like maple syrup, and then just keep her on that dose a couple times a day. A lot of our breeders have had good luck with it, but I wouldn't say that's the end all be all, but may help if you're looking for something over the counter.
This was our group of students waiting to deliver puppies. I forget, we had I think this was a Leonberger with 12 puppies. So we had all the students lined up to help resuscitate puppies. This is our puppy warmer. It's our incubator for puppies. This was a litter of Labradors that we bred for a client, and I happened to go visit them when they were a house full.
They just keep coming.
At what age do you consider a failure of testicles to descend not going to happen? At least in dogs, this is somewhat of a loaded question. If you're a staunch proponent of not breeding anything that's potentially heritable, the guideline is by 2 weeks of age, which a lot of people go, what? So other people say by puberty, which is obviously several months of age. We know that retained testicles or cryptorchidism is heritable. There's probably various degrees of cryptorchidism from those dogs that are slow to descend to those dogs that never descend. So if you have that dog, and if it's a purebred dog and his genetics are superior and everything else, but his testicles didn't show up till he was 4 months of age, you might have to say, you know what, maybe I'm still going to breed him, knowing that we may be contributing to another genetic problem. We get very few, when we deal with genetics, heritable conditions, we usually don't get something for nothing. If you start choosing against all heritable diseases, something else usually goes wrong. But again, conventionally, if you say the longest I would usually recommend is the dog goes through puberty. In other words, he's capable of producing semen from the testicle that's down, or if he's got bilateral cryptorchids and neither testicle is descended, and he's, conventionally we usually figure between 60 and 70% of mature body size is when puberty should occur. Then he's probably never going to show up. There are some medications that have been proposed for this, but to be honest, none of them have ever really proven to be work. A lot of them probably were going to descend anyway. So depending on how much of a purist you are about not wanting to breed something with retained testicles, the answer can vary from a couple of weeks to several months. So I don't have a good answer for you, Vicky. And then from a current student, where does one get training to do spays laparoscopically? I hope senior year, because that's when our students get to see them. I'm sure there are laparoscopic courses out there that you can take that should be able to show you, but actually we don't do we don't really do, the therio service doesn't do normal spays here. We do the abnormal ones, and the ovary sparing spays or hysterectomies, but the surgery service does the laparoscopic. I don't know where you go to school. Are you one of ours, Emmy?
Yes.
Oh, okay. Well, Emmy, then you should learn this during surgery class, junior year and then 4th year. Yay.
One final question in the chat.
Uh-oh. What works best for milk 2 weeks old? We're kind of old school, and just use the standard, commercial milk replacers, the Esbalac or something like that. I know there are numerous homemade recipes using goat's milk and such. We usually just recommend the Esbalac or something like that. And actually what we usually recommend, if possible, is use the canned products that are already pre-mixed, unless you're really good about mixing. Dr. Estel, our other theriogenologist here, who's had a lot of puppies on his own, feels like a lot of clients have trouble with the mixing directions, especially because the powder has a tendency of kind of compressing and making the measurements harder. So no, I know I hear stories all the time about goat's milk, so I can't argue with those that have gotten good. And I think there was a question about the dose for fenugreek. Any starting dose, fenugreek 9-pound bitch.
Nope, just feed it to her until the birthing area smells like maple syrup.
Till she
That's what I
smells
was
like
told.
maple syrup.
Thank you both. I'll run through the last few slides and we'll close out.
Great, thanks, Jens.
Thanks for attending.
Share a couple resources to close us out. This is the contact information for the small animal clinic. So if you have questions related to specific things you need for your animal, feel free to get a hold of us via this information. If you have questions about the event, feel free to contact veteditor@oregonstate.edu, or you can reach me personally at my email address on the screen. Don't forget to check vetmed.oregonstate.edu/FURst Aid for recording of this and all of our other FURst Aid events, as well as to find out about future events. So we do 3 to 4 of these per year. They're all free, and most of them are offered hybrid via in-person and webinar. And finally, don't forget to follow us on social media to keep in touch with us. Thank you all for attending both in person and online. Have a great evening. Take care.